Today, my lecture will be assessment of the normal newborn. We have 3 transition phases when we assess the normal newborn. Phase 1 is the first hour. Phase 2 is from 1 to 3 hours. Phase 3 is from 2 to 12 hours. So these are very critical timings affecting the newborn at the beginning of just after delivery. What are the priorities in the first hour? When I'm a doctor, I'm attending the delivery and I'm checking the baby in the first hour, the newborn in the first hour. What are my priorities? My priorities are, number 1, cardiovascular assessment and support, thermoregulation, assessment and support of blood glucose, identification of the newborn or of any problems affecting the newborn, observing urinary and meconium passage, I mean urine and stools, observing for any major anomalies and for apparent gestational age concerns. So when I'm a doctor attending the delivery, I have to have priorities in the first hour of life. First thing and most important thing when I'm receiving a newborn is the APGAR score. APGAR score. The APGAR score is a score that is assessed in the 1 and 5 minutes, first and after 5 minutes. And it's meant to identify the need for neonatal resuscitation. So I need to check the APGAR score, and accordingly, according to the score, I will decide if my baby needs, this newborn needs resuscitation or not. So the APGAR score rates respiration, crying, reflexes, I mean the irritability of the child, pulse, heart rate, skin color of the body and extremities, and the muscle tone. So as we can see here, I have score 2, 1, and 0. So 2 is the best and 0 is the worst. APGAR stands for A, appearance, P is pulse, G, grimace, A, activity, and R, respiration. So if I have a score of 2 in any of them, it's the best. 1, it's a bit alarming, and 0 is means the baby is going to need resuscitation. First of all, appearance. Score 2 if the baby is pink. The baby is going to take a score of 1 if the extremities are blue. As we can see here in the schedule, it has the pictures. And of course, the baby will take a 0 in the score if the baby is pale or blue. So either pallor or complete cyanosis will give the baby a score of 0. What about the pulse? If the baby's heart rate is more than 100 beats per minute, so I'm going to give the baby a score of 2. If the baby's heart rate is less than 100 beats per minute, I'm giving the baby a score of 1. And if the baby has no pulse, he's taking a 0. What about grimace? Grimace, if the baby cries and pulls away, I'm giving him a score of 2. If the baby grimaces or has a weak cry, I'm giving them a score of 1. And if the baby does not give me any response to stimulation, I'm giving them a score of 0. What about the activity? Is my baby completely and actively moving? I'm giving a score 2. The baby has moderate activity. It means the activity is affected, so his arms and legs are flexed. I'm giving a score of 1. And if the baby has no movement, I'm giving them a score of 0. And last thing, R stands for respiration. So if the baby has a strong cry, I'm giving them a score 2. If they have a slow or irregular respiration and cry, I'm giving them a score 1. And if the baby does not breathe at all, I'm giving a score of 0. So if we follow the schedule for the score, this is the same schedule, but it's not with pictures. So the APGAR score system, as we said, 0, 1, and 2. So what does it indicate? The baby is in excellent condition if he takes a score from 7 to 10. The baby is moderately depressed if he takes a score from 4 to 6, and if he takes a score from 0 to 3, then this baby is severely depressed. And it's an indication that the baby will need immediate resuscitation. What are the additional signs of respiratory distress? Persistent cyanosis, grunting respirations, flaring of the nostrils, retractions. We have intercostal and subcostal retractions. Respiratory rate in the neonate, if it's more than 60, it's very alarming. And if the heart rate is more than 160 or less than 110 beats per minute. So these are additional signs that the baby is having respiratory distress. How to maintain thermoregulation? How to maintain the baby's temperature? So what is thermoregulation? How do I maintain it? It is referred to as maintaining a neutral thermal environment for this newborn. I have to make sure that the heat loss is minimal and oxygen consumption needs are at their lowest. So I have to maintain a neutral thermal environment. So the neutral thermal environment refers to heat loss. It's going to be minimal and oxygen consumption needs are at their lowest. If the baby develops hypothermia, what can happen? Hypothermia can cause hypoglycemia as well as increased oxygen need.